listening to the Pharmacist Answers podcast. I'm Cynthia, the pharmacist, and today you'll get your questions answered and your curiosity cured. What do you do if you and your doctor disagree about something about your treatment? Now, some people have seen the same doctor for years and years and years, and the fear of switching doctors is kind of heavy. But there may be times when, especially if you are taking the time and making the effort to learn things about your health, learn things about your body, educate yourself about the things that you're dealing with or how to identify things in your own body, take more control in your health care and how you're treated versus the doctor saying this is what you do and you just saying Captain and just doing it. I'm a big proponent of wanting people to be armed with information, to be empowered in the decision making for their own health, versus just going on the whim of what the doctors say and expecting them to be the expert and expecting them to always be right. So when you are making that step and educating yourself, then you run the risk of coming to a point where you and your doctor may disagree about the type of treatment that you may receive, whether it's for a chronic condition that you've suddenly discovered you had, or whether it's an acute illness or infection or cold or virus or something like that, especially in the wintertime when lots of people are getting sick. So what do you do if you and your doctor disagree about your type of treatment? Well, the easiest way is to at least be an adult about it. And maybe being an adult isn't necessarily easy. But sometimes the way that creates the least amount of friction is to respectfully say, I've been learning about this on my own from respected resources, and not saying, well, I Googled this, because don't Google. Googling things will convince you that you're dying faster than anything else, even when you're not. So don't Google things. But if you're learning information about yourself and about your conditions or your health from respected resources, then providing the doctor with that respected resource, the information that you learned, to see if maybe they can learn something. I personally had to do this when I was pregnant. My pregnancy and the birth of my two children was supported by a midwife. And so midwives are more open to natural remedies, letting nature do its thing. And so one of the more natural remedies for the end of pregnancy to prepare for delivery is using evening primrose oil. And I had learned about it from one midwife that I respected and trusted. And when I suggested it to this other midwife, she was like, I've never heard of that. And you don't want to do things to try to induce labor on your own, which there's all kinds of ways to induce labor, and they tell you there's all these home remedies that you can do to induce labor when you're ready to have a baby, and they're dumb and they're dangerous and you don't do them. But this was something that I knew was well researched, well documented, had personal use with it before, and I suggested to her, and then she just kind of blew me off, and I was like, whoa, wait a minute. And so I was able to find the resources that I had learned about it originally and provide it to her and say, this really isn't a labor induction type of supplement. It works completely different in supporting the body's natural process into going into labor. So it's not going to make you go into labor faster. It's just going to help your body once it decides it wants to go into labor on its own. And we were able to come to an agreement and say, okay, great. That actually sounds a lot better than it sounded, because I'm sure she has other people who will Google things and be like, I think I'm going to take some castor oil to induce labor. And then she's like, no, you don't want to do that. And I agreed, no, don't do that. But that was a time where she and I kind of had an impasse in saying, you don't want to do that to your body. And I'm like, yeah, I think I kind of do, because I've done it before. And it was for me to provide her with information and her willingly accept it, read it, and then come back and say, okay, that actually sounds well supported and like a good idea. We were able to then like maintain our relationship as her being my healthcare provider for my pregnancy. So that's a good idea. If you have resources, well-respected resources that you've learned things about, whether it's mainstream medication and medical treatments, or if it's the complementary medications that has to do with herbal supplements and natural treatments, providing that respected resource to your doctor for them to read if they're willing to accept it. Now, if they're not willing to accept it, then you may have to reevaluate your relationship with that doctor. If the disagreement is super strong on the doctor's part, as in they don't want you to be empowered and help make decisions about your health, then that may be another reason that you need to reevaluate the relationship with your doctor. One of the things that you can do, and most doctors should be willing to do this if they want to keep good business. We did this with our pediatrician, and I've never actually had to do it with like a PCP or a family doctor, but actually asking for an interview and sitting down with that doctor or with the provider from that practice that you're going to be seeing and asking the hard questions of how they treat you, how they will respect your participation in the decision making, and anything else that you want to know from that doctor of how they practice medicine, before you decide, say, hey, okay, I'm going to become a patient of yours. Because there's so many times that insurance companies seem to dictate what kind of treatments you can have and what types you can't. Doctors seem to dictate what type of patients they're going to take and what types they aren't. And that really limits the individual person and their ability to make decisions and choosing what they want. And so we did that with the pediatrician that my girls see. Before my first daughter was born, we went to the pediatrician. We sat down and we asked all kinds of questions of how she treated kids, how vigorous she was about prescribing antibiotics, because some kids, parents will take their kids to the doctor and be like, she's got the sniffles, and the doctor will write an antibiotic like on demand. And I'm going, that's not the right way to practice medicine. So we asked all these hard questions of what was her criteria for diagnosing children with attention deficits and things like that, because other doctors, parents will go in and be like, I can't control her, she doesn't respond to discipline. They'll write ADHD medications when that's probably not the first thing you need to do. So asking those hard questions of how you or your children are going to be treated before you agree to have them as a healthcare provider in your life. Doctors should allow that. If they don't, then you need to find a doctor that does, to be able to have that interview if you're looking for a new doctor, to sit down and ask the hard questions of what type of, how aggressive they are about certain things, how respectful they are when you come in to wanting to participate in the decision-making process versus just doing everything that the doctor tells you to do, how accepting they are to complementary treatments and natural supplements and things like that, if that's what you're into, holistic medicines, how accepting they are to those things, and finding a doctor that is not going to align with you and just do everything that you want to, but when your values and your beliefs align with what your doctor is, then you're going to get the best treatment possible. Because you're going to get to participate and make decisions for yourself so you feel empowered, but then your doctor is actually going to be supporting you instead of fighting against you. So one, if you've got a good doctor and you happen to disagree, provide them with resources. No, you don't necessarily want to win them over to your side, but giving them some resources that they may not have had before, so then y'all can come to an agreement and make the best decision for you. And if your doctor isn't willing to do that, then finding a doctor actually interviewing that doctor for your treatments, so then you can build the best healthcare team for you. Whether you just need a PCP or whether you're having to deal with a specialist because of a particular chronic illness, such as type 1 or type 2 diabetes, or a rheumatologist, or things like that, you do have the ability to choose, even though doctors and insurances and a lot of the mainstream healthcare try to convince you that you don't have the choice. You really do. So being able to know that and be empowered by the fact that you do have a choice and you can make the decision and actually change doctors if a particular doctor isn't supporting the best you the way you feel like they should. Bye. Thanks for listening to the Pharmacist Answers podcast. The pharmacy is now closed. You can post your questions and comments on our Facebook page. That's facebook.com/pharmanswerspod. Or you can email the show at pharmacistanswershere@gmail.com. You can tweet me or message me on Twitter at @SinHendrix. You can find the show notes at pharmacistanswershere.wordpress.com. Pharmacist Answers broadcasts live on Monday, Wednesday, and Thursday at 9:02 a.m. Eastern Time on the Periscope app. You can follow me at SinHendrix or view in your web browser at periscope.tv/SinHendrix. See you next time on the Pharmacist Answers podcast.